Hello, thanks for tuning in. Welcome to the 313 podcast. I'm joined by my co host, Deep
Hello there.
and Jill,
Hi.
and I'm Nicholas. Today we're going to be talking about COVID 19. Now, of course, with any good topic, we kind of have to address the basics. What is COVID 19? The full name of COVID 19 is Severe Acute Respiratory Syndrome Coronavirus 2. Now, that is a mouthful, so you could just refer to it as SARS CoV 2. Now, if you're thinking to yourself, why 2? That's mainly because SARS CoV 1 is the SARS virus, which was an epidemic. Now, it is a novel virus, which means it is a new pathogen of a previously known type. Since we already knew of SARS, this is SARS-2, making it a new virus, a new novel virus. So, COVID-19 itself originated from uh, pangolins, which by ancestry then spread to bats, which then spread to us. We are we are one of the few known species that have disease like this, with the other two being bats and pangolins. And the disease does originate from China. That is where the outbreak originally happened. Now, the reason why it's spread is because it's very hard to track down, and also because it has a long lifespan. It tends to stay in humans for a long time, as well as on outside surfaces for longer than your average virus. Since this is a relatively new virus, most of what we know is limited, and one of the things that it does is it causes coronavirus disease.
So, learning about COVID-19, how does not knowing or understanding COVID-19 create panic throughout the world, causing more pressure on technological fields? What do you guys think?
I think that there's like a huge aspect with hoarding resources and I know like the first thing that comes to mind is like toilet paper and stuff, but then there's also like the whole shortage with like masks and stuff because people are like taking those like resources that doctors need for themselves for when they go outside, which is like that whole like thing in the news about having masks for like when we go outside, but you're supposed to save those like surgical masks and like those more like medical masks for doctors and nurses and like people who deal with those patients.
And you also have to
Exactly.
think
So,
that hospitals are hoarding these things too. Like certain hospitals have more of one thing and they're not sharing because there's not a lot of knowledge of this in general, so people don't know how much to prepare for it. So there's a lot of hoarding not going on not just between people but also hospitals and healthcare places.
and I think the more people learn about COVID-19, the more people will learn that we should be focusing on people that are immunocompromised and the healthcare workers because their safety is the most important out of everyone because they're the most affected. And I think hoarding should soon be prevented as more people learn about COVID-19. So, now that we know what COVID-19 is, the next question is how it's affecting our body. So, several symptoms of COVID-19 is fever, tiredness, dry cough, pressure in the chest, bluish lips, ground glass opacity, which is extra fluid in the lungs, causing trouble in breathing, and finally, blood clots in the lungs that can and will eventually kill you.
Yeah, and like those like ground glass opacity is not like something that we can see. It's more like when you get scanned, like a CT scan, just like a bunch of X-rays, and that's like it literally looks like glass in your lungs, but it's really just fluid in those pictures.
So when I think about symptoms, I remember that many youths right now are thinking that they are completely immune to this disease and will be safe and will not die. However, this once again creates more youths to go outside and to interact with each other, causing more pressure on biotechnology field and healthcare workers. So, what's your thoughts on that?
I do think it's one of the first like responses to this virus. Actually, one of the first like tidbits people really heard about this virus is that it's more dangerous towards the immunocompromised as well as the elderly, and I feel like that wasn't really a good thing because then people just thought, well, I'm safe. I can't be hurt
Yeah.
because I'm not immunocompromised or el- or one of the elderly. And the problem with that is it's really not about like dying from the sickness, is more like contracting it. Contracting it is a very dangerous thing because if you contract it, think about all the people you'll be passing it on to, the elderly people that you'll be passing it on to, the immunocompromised that you'll be passing it on to. All those people are going to get infected because you thought you wouldn't die from it. And in return, you may have actually killed someone else.
Yeah, and like another thing about that is like even though you don't think that you're gonna die from it, even like contracting it is like it's horrible because like not being able to breathe and like having all these symptoms that we talked about before, like that stuff, like it hurts and it really like you can't do anything about it. Like you're just like sick, and like even though you might not die from it, no one wants to be sick.
And even like the ground glass opacity will cause further problems and damage your lungs severely. So that will cause major problems later in your life. So I think youth should be more careful on how they envision going outside and meeting other people.
Yeah. So like going back to what we said about spreading the disease is that people they can be carriers or they can be affected by it, but they won't necessarily show any of these symptoms. And that's why testing is like really important right now, even though it's scarce. Getting tested, like knowing your status, I guess, uh, helps like keep from the spread. So there's these two types of tests, and one uses your DNA swabs, and one uses plasma from your blood. And the one that uses your DNA swabs is that they literally take a swab and they like shove it way up your nose to your pharyngeal region, but it's like the back of your nose, that like area that connects with the mouth. And this is called an RT-PCR test, which is they use RNA as a template and then they transcribe it into DNA, which is that reverse transcription part. They put in a thermal cycler, they amplify your DNA or like they multiply it so that your DNA can actually be used, and they put it into gel electrophoresis, which basically just compares it with a positive sample of DNA. This test is better for if you're actually infected. So if you're sick and you're showing these symptoms and you go to a doctor and you get tested, uh, they're more likely to put you with this test because it's more accurate for when you're infected. But the other type of test, the plasma test, is an ELISA test, which tests for antibodies in your blood. And these antibodies show that you were infected with this virus. So it's not necessarily that you have it right now, but like you have had it. And they take your plasma. So when it's put into the incubator uh, and it's washed, it shows color. And this color basically means that the antibodies that are in your blood uh, bind to the viral protein. And like I said, this is better for after you're infected because after you are infected, your body produces antibodies to fight the virus if it comes back again.
And one thing to notice is that there's it's really hard in general to just tell whether you have it or not. Like Jill said, there are people who are carriers of the disease. There are people who are infected and the who are infected and aren't experiencing symptoms. And one of the common things that people know is that it typically takes about 2 weeks for symptoms to appear, and at that point you could have already spread the virus. And I think that's very important to think about.
Yeah.
Yeah, and I wanted to shed light on how researchers right now are working so hard and all day and all night to bring out tests and help people who are suffering and bring out possible treatments for COVID-19. And I think that's insane. I think that their work ethic has been incredible, and I think that should be shed more light on.
Yeah,
Yeah.
the process towards like figuring out how to fight this whole virus and the pandemic we've been going on has really been tough. It's been tough for those working on it. It's been tough for anyone involved in the biotechnology sort of like area. Even in anyone in medical science and even in medical like areas, they're all experiencing really the full weight of the pandemic, and it's and by really knowing about these things, it's easier for us to like help, and not just help, but just by being aware, it's easier to really to help them deal with it.
Yeah, to sympathize with them, like whatever we're going through, they're probably going they're more like in the action of it. They experience it a lot more than we do staying home.
Yeah, and this like capitalizes the point of spreading information, how shedding light onto these researchers working several hours just to help us, and how we should stay at home to help them. So, of course, if someone actually tests positive, then the next step is for them to get treatment, as we were talking about earlier about researchers. Well, ways to prevent catching COVID-19 is to social distance and to prevent catching diseases from an infected person. Another way is to disinfect objects and continuously wash hands with soap. Researchers have been working incredibly hard to find various treatments for COVID-19, and so far, this is what they've been working on. Convalescent plasma. This is where plasma is taken from people who recovered from COVID-19 and is transfused to sick patients. This plasma helps the immune system identify the virus and helps the immune system kill that virus. This is the main treatment for COVID-19 and the main way of preventing it for preventing death for several patients. Another idea that researchers have researched is the HIV drugs or the antiretroviral drugs, which were thought to help patients suffering from COVID-19. However, researchers have learned that these drugs don't improve a patient's condition faster, and it didn't affect the rate of death. Researchers are still conducting research about these drugs, and they have hope that these drugs will be useful for less advanced versions of COVID-19. Another drug that has been thoroughly researched is the anti-malaria drug, hydroxychloroquine. And this was also thought to help patients with COVID-19, but sadly, researchers have found this drug does not reduce the mortality rate, causing it to be not as researched as several other ways.
I think like one topic I want to bring up, especially with this anti-malaria drug, is that when this kind of information first came out, I remember that was like a big thing in the news about how like this is the cure, but like now that we learned that it's not actually as effective as we think it is, that's just kind of spreading more like ideas that we're here to um, bring down. Is that just because these drugs are being used doesn't mean that they're really effective, because this, like we said, this virus is still new and we don't know much about it.
And one thing I found interesting is that there's little like hope to see in all of this because this is a pretty grim time, but it's interesting to see all these researchers work together to find several ways to help patients suffering with COVID-19. It's been enlightening, for me at least, to see several people all across the world help each other with spreading information about COVID-19 and teaching others and other researchers about possible drugs that can be used to prevent it. I think that needs to be spread around because once again, there's little hope, but that itself, I believe, will cause more hope.
Especially in like the prevention aspect. That's why we're all quarantined. That's why we all need to stay home. Why like essential workers should be the only ones like going out, and that's why we're doing this podcast on a video call. Is like we're trying to prevent the spread. So yeah. Uh, so this talk about treatment before getting infected is also related to like vaccines, and developing a vaccine is like there's a lot of tests into trying to get an effective vaccine. A lot of countries countries, a lot of researchers are working on that. And I think what I want to focus on, like, there's 6 types of vaccines, but what I want to focus on is the ones that I heard or like read about that are being developed for this virus specifically. Is there's the inactive vaccine, which focuses on like using the dead version of the drug and or sorry the dead version of the virus and injecting that into our blood produces those antibodies. It creates the immune response, but it doesn't actually infect us with the sickness. And then there's also the attenuated virus, which uses a live version of the virus, but it's being altered so that we don't really get infected. It's like it's really weak, so we don't get infected, but like again, that immune response is still being triggered.
Yeah, because when you really the main thing about like viruses and sicknesses like this, what people don't realize is there's a difference between the virus and the disease, especially at times like this. Uh, and that's kind of the big thing with vaccines. People have to realize that if you get infected with the virus, that doesn't mean you'll always contract the illness. Your body can fight off the virus before you contract it, and that's kind of the whole point with attenuated vaccines is that they're weakened. You're contracting a weakened version of the virus, and you're beating it before it gives you the illness, which is kind of like which is kind of like something people don't really realize when they think about viruses is how they're separated from the disease.
So like what researchers are doing right now with vaccines is that they're taking the virus and they take the virus in the early stages and they alter the proteins so that it's not as strong and we won't really get sick from it.
I think when I hear all about this, I remember that there's a lot of fake news coming about vaccines coming more quickly than expected. And I believe that creates a ton of pressure on the researchers and the people creating these vaccines because they're expected to create a vaccine sooner than actually possible.
Yeah.
And I wonder if that itself, as like a hope for a vaccine, is creating more people to go outside and be like, "Oh, this there's a vaccine coming out like next month. We'll be fine."
Yeah.
And I believe that that's a huge dangerous part about it.
So one of the reasons why vaccines really take a long time is because they have 6 phases. You're not going to really see a lot of improvement over short periods of time simply because of these 6 phases. One of the main, one of the longest phases being testing. Testing is a very big part of vaccines because you actually have to know it works. And the first phase is done on animals because it is you're not allowed to test on humans before you test on animals. And once you get through animals, then you have to test with humans, and that itself is like a 3-step process. And those being the amount of people you tested on. And so with that, you're not really going to see a lot of development in a lot of time. The vaccine itself may be created quickly, but whether it works and whether it'll come out to stores and whether it'll be manufactured quickly will take quite a long time for someone to actually receive like the vaccine from hospitals.
Yeah, and I think people don't realize that like vaccines, their main role is to actually like help people and not prevent further disease. So that's what the FDA and several people producing the vaccine are trying to focus on. And that itself takes a lot of time because they have to continue testing, continue trying to figure out the problems with the vaccine before manufacturing it.
Yeah, like at this point it's said that like developing a vaccine could take up to like 18 months, right? So, all these people thinking that like this virus is going to be over soon, like the reality is it's not really. It could take up like more than a year to do so.
And another thought I had is that people are thinking it might end in a few months and then it's going to be over forever. But no, it's probably going to return in the winter because viruses usually die down during the summer because of heat. So we might have another few weeks where we have to social distance once again in the winter, and I don't think many people realize that.
I think one of the most important vaccines to focus on is the conjugate vaccine. The conjugate vaccine, what it is, it's basically will only be taking the protein coat of the virus, and you're using that to cause your immune system to know how to fight the vaccine. And I think that's one of the more possible vaccines, or one of the most possible types of vaccines, simply because that vaccine is a very strong, like it stays with your body, because there are vaccines where you need booster shots, and this one is strong enough that you don't need any.
And like when it comes to vaccines, sometimes I worry that people who are anti-vax will continue to spread this disease and continue to pressure hospital workers. So that itself worries me because COVID-19 will never fully die out, and anti-vax people will continue to spread this disease.
Yeah, one thing I've kind of been like thinking throughout this entire pandemic is sort of the response to the fact that really there's only going to be viruses, no, sorry, not viruses, there's only going to be vaccines coming out of this sort of thing to combat it. There's not going to be a lot of treatments. And I really think the thing about the vaccine is that I'm kind of hoping that the people that are anti-vax will sort of realize the importance of it, you know, because now that we're hearing all this important about like developing a vaccine, getting it out to the public, we'll start to get more education about how much we really need it and how important it is to us. Because vaccines have been sort of necessary to combat some of these big illnesses. Typically, when vaccines were created, they were cause for great celebration, because there were these diseases that plagued humanity for so long, and then all of a sudden it's gone from a vaccine. And I think now people are really going to understand that how much good is going to come from this. After we get the vaccine, it's going to be a lot easier to return back to normal living. And from that, I hope that people who are anti-vax will see how important it is.
But I truly love the appreciation for medical workers right now because I see several communities rallying together to bring light and joy to medical workers who are suffering right now. And this disease not only affects them physically, but it affects them mentally as well because many have to stay away from their family and loved ones, and that itself makes me so sad because these workers are working so hard to provide care for all of us, and it brings me joy that so many neighborhoods are and people are bringing appreciation to these people.
Yeah, there are even stories of people who previously left their healthcare jobs to do other things, coming back and doing that to help others. And I think that's really good. How we have all these people coming in to help, not only helping in the healthcare section, but in the emergency responders, and also all the other necessary jobs that need to be done. All the people working in the cashiers, all those people, they're really coming together and risking their lives to get us what we need. And so I I think all of us here would like to thank everyone for really contributing to the pandemic and helping everyone out. I know this isn't, a very popular podcast, but I really just like all of us would really like to thank everyone who's been working like all day, every day, just to help everyone. So thanks for listening in. This has been the 313 podcast. Uh,
In next podcast, we'll be going over more pandemics.